Hi guys, today we are going to be looking at some telltale symptoms and the diseases or conditions that they are telling on. We're going to look at 10 and talk a little bit about the diseases as well, not in too much depth though. First of all, just a kind of a small disclaimer. I am obviously not a doctor nor a medical profession, so this is really just for your entertainment and information. If you have any of these symptoms, it doesn't necessarily mean that you have the disease we're talking about. And of course, some of these conditions, people suffer from them without having these symptoms. And these symptoms can be related to different diseases that we are not going to talk about today as well. So keep that in mind. Nonetheless, it's good to know a couple of illnesses, whether they be common or rare, and what symptoms to look out for, especially in the cases of some which can be fatal. So let's get started. The first strange symptom that we'll look at today is loss of hair in the outer third of your eyebrows. This can mean that you have hypothyroidism, which means you have an underactive thyroid. Of course, it's not the only symptom. In fact, hypothyroidism usually leads to hair loss in general. It's caused by a lack of thyroid hormone, and it kind of makes the body slow down a bit in general. All the systems and processes get a little bit slower, so the hair doesn't grow as much. People usually feel tired. They can be depressed as well, gain weight. Everything just kind of slows down, and I think they feel tired as well. And another symptom, which just an extra bonus symptom, is they might have a goitre, which is swelling. The thyroid gland is in your neck. It's a butterfly-shaped gland. And when that swells up, it is called a goitre, and I'll show you a picture here. So yes, the loss of hair in the outer third of the eyebrow can mean hypothyroidism. Moving on to the next symptom, which is bulging eyes. Sometimes you see people, maybe not in person, but if you are looking in medical books, you will probably see images of people who have kind of these it looks like their eyes are kind of popping out of their eye sockets. Very unnerving, and I'm sure it must be to them as well. And a cause of bulging eyes can be hyperthyroidism, which is the opposite of hypothyroidism, the first disease we looked at. And hyper, just something to keep in mind, these words, knowing what these little suffixes and prefixes and a couple of words in Latin and Greek when it comes to medical things, knowing what they mean is useful to understand a lot of things. You can usually work out something just by knowing the little particles that make up the longer word. So hypo means under and hyper means over or above. So hyperthyroidism is when your thyroid gland is overactive, producing too much thyroid hormone. And the other symptoms of hyperthyroidism tend to be the opposite of the hypothyroidism, because everything is speeding up, all the processes of your body are going faster, so people are usually maybe anxious, irritable, they have weight loss even though they're eating and drinking a lot. And of course they might get this bulging eyes, and this is known as Graves' ophthalmopathy. Ophthalmopathy, anything that sounds like opt or off, is usually relating to the eye. And pathy, which is obviously seen a lot in medicine, means feeling, suffering, emotion, disorder, or disease. Originally coming from the Greek patheia, act of suffering or feeling. So Graves' ophthalmopathy usually occurs when your eyes may seem enlarged as a result of your eyelids retracting. And apparently when this happens, your eyes may begin to bulge from your eye sockets. So Graves' disease, the reason I'm mentioning this is it is the cause of about 50% to 80% of the cases of hyperthyroidism in the United States. The next peculiar symptom that I hope you never come into contact with is this. A red swelling with a circular kind of shape around it. This might mean that you have been bitten by a tick which has transmitted Lyme disease to you. So Lyme disease is also known as Lyme borreliosis, and it's an infectious disease caused by bacteria which is spread by ticks. And the most common sign of infection is an expanding area of redness on the skin, and it begins at the place where the tick bit you. Not immediately, but about a week after you got the bite. It's actually not usually itchy or painful, so probably maybe a little bit more difficult to notice if it's in a place of your body that you don't look very much. And even a quarter to half of people do not even develop this rash. So keep that in mind. But you really want to try to avoid this disease because it can get very serious and long-lasting as well. Other symptoms are headache, fever, feeling tired. It may even go as far as losing the ability to move on one or both sides of the face, along with joint pains and severe headaches, neck stiffness, heart palpitations, and you can get repeated episodes for years afterwards. But one good thing is that the tick has to be attached for 36 to 48 hours before this bacteria can start to spread in your body. So, if you ever go out in a place where you might get a tick bite, luckily it's never happened to me, although I hear it is very easy to do if you're walking in woods, maybe where deer have been, for example. Just get somebody maybe to check you over, or just check yourself over first and then get someone else to maybe check the parts that you can't see, like, I don't know, behind your elbows or wherever. But I think it's a very important disease to avoid. The next symptom is this: skin burns and blisters. I'm mentioning because it came up when I was researching about Lyme disease, and this one is also called Lyme disease, but it's important to differentiate between the two because they are entirely different. The first one is Lyme with a Y, so that's the tick bite one. This one is Lyme like the fruit, Lyme, and it's also known as phytophotodermatitis. So it's a rather long word, 8 syllables. So let's break it down and figure out what it means. Well, phyto means plant. You might have heard that before from phytoestrogens, for example, which are in beer and hops. Photo means light, so we have plant, light. Derma refers to your skin, specifically the dermis, which is under the epidermis. The epidermis is like the top layer, and then we have the dermis underneath. And itis, as we saw before, very common word in illnesses, means inflammation. So inflammation of the skin regarding light and plants. And let me explain. So it's a chemical reaction which makes skin hypersensitive to ultraviolet light. And it is caused by contact with photosensitizing compounds, which are naturally found in some plants and vegetables and even citrus fruits, which is probably why it's called Lyme disease. However, this can be related to a plant called the giant hogweed. You've probably heard about it, a bit of a nightmare plant. And this is, I think it affects people differently. I don't know if different plants have varying degrees of these chemicals. But some people, when they touch off, even just brush against the leaves of a giant hogweed, which usually grows around riverbanks and kind of wet areas, and it's really, really big, they get blisters and burns, kind of red marks on their skin that stay for days, and then afterwards they are extra sensitive to ultraviolet light in that area on their skin. So very scary thing. I remember my father warning us about this when we were children, because I think there was like an outbreak of giant hogweeds or something near where we lived. We did have normal hogweed. Normal hogweeds are completely fine. They don't produce this substance. We had one in our garden for a while, and I quite liked it. So just to give an idea of what to expect with the giant hogweed, it resembles the common hogweed. It is native to the Caucasus region and Central Asia, and it was introduced to Britain as an ornamental plant in the 19th century, and then it has also spread to other parts of Europe and the United States and Canada. If you do end up touching a giant hogweed accidentally, you should wash the area affected very well with soap and cold water as soon as possible and cover it up. Keep the area of your skin away from sunlight for 48 hours, but if you have a reaction, see a medical professional. Next up, we have double vision. So double vision is when instead of seeing one clear image of the thing you're looking at, obviously your eyes cannot focus, they cannot converge the image properly, so you end up seeing two of the same thing, double vision. And this could mean that multiple sclerosis is at work. Or it could mean maybe you just had too much to drink. See, with these symptoms, just focusing on one, it's very, there's a wide range of reasons for why they could happen. But anyway, with multiple sclerosis, the patient who's suffering from this can have almost any neurological symptom or sign because it's affecting your nerves. As we saw before when we were doing the nervous system, multiple sclerosis it damages the myelin, which is like the insulation all along the nerve cells in your body, and the myelin is needed to insulate them and to make the impulses go faster. So for that reason, the symptoms can be loss of sensitivity, changes in sensation, tingling, pins and needles, numbness, muscle weakness, blurred vision, muscle spasms, problems with coordination and balance, problems with speech or swallowing, and visual problems. And the double vision is just one of 3 things that can happen. You can also get nystagmus, which is also called dancing eyes, which is like involuntary movement like that of the eye, and optic neuritis as well. And the correct term for double vision is diplopia. Well, I mentioned drinking too much leading to double vision, but how about if you always wake up or frequently wake up with a hangover or even feel drunk, but you haven't been drinking? What could that mean? That is actually a symptom, and it is related to a very strange disease. It's very rare, but it's called auto-brewery syndrome. And it's also known as gut fermentation syndrome. It's a rare medical condition in which intoxicating quantities of ethanol are produced through endogenous fermentation within the digestive system. So basically your body starts to work like a brewery. It just starts to produce alcohol within the digestive system. And then when you absorb it, you could get a little bit drunk. And one gastrointestinal organism I don't know if I'm going to say this correctly, Saccharomyces cerevisiae, which is a type of yeast, has been identified as a pathogen for this condition. And some people have tried to use this as a defense against drunk driving. And one case went undetected for 20 years. As you can imagine, the effects of the disease can have some serious repercussions in life if you were going around, drunk all the time, or just getting drunk at unexpected or inappropriate moments. The side effects are apparently excessive belching, dizziness, dry mouth, hangovers, disorientation, irritable bowel syndrome, and chronic fatigue syndrome. Poor productivity in employment, I can imagine. Next up for the symptoms, we have a kind of a set of symptoms, and this is like respiratory problems, including coughing, shortness of breath, along with a high fever, muscle pains, and headaches. Okay, so this could be many things. These are kind of rather general respiratory symptoms, but in this case, we are going to focus only on Legionnaire's disease. So if you have these set of symptoms after using maybe a jacuzzi or a hot water system or an air conditioning system, which I know we kind of use them all the time in our daily lives, but that is where this bacteria comes from. So Legionnaire's disease, it causes an atypical pneumonia, and it's caused by any type of Legionella bacteria, usually spread by breathing in the aerosolized water and or soil contaminated with the Legionella bacteria. It's not transmitted from person to person. So this bacteria lives in hot water tanks. Well, it can live in hot water tanks, cooling towers, evaporative condensers of large air conditioning systems, like those found in hotels and large office buildings. And it thrives between 25 and 45 degrees Celsius, which is 77 and 113 Fahrenheit. And its ideal temperature, the one that it's happiest at, is 35 degrees Celsius or 95 degrees Fahrenheit. So the risk cannot be completely eliminated, but you can reduce the risk by enforcing a highly detailed, systematic water safety plan for large buildings and facilities. For example, office buildings, hospitals, hotels, spas, cruise ships, etc. And they include maintaining the water at specific temperatures, like too low or too high for this Legionella bacteria, preventing stagnation, of course, which is good in any situation, preventing the buildup of biofilm, and periodic disinfection of the system. So I suppose when it comes to large buildings like shopping centers and offices, we'll just have to trust that the people in charge are doing that to prevent the Legionella bacteria from spreading. The next symptom is a sore, stiff neck. So if your neck feels too painful to maybe move forward or back very far, then you might be suffering from meningitis. Meningitis, we've all heard about this terrible disease. There are different types of it, but again, looking at the name of it, meningitis, it comes from the meninges, which are the covering of the brain, like in between the brain and the skull. There's 3 layers, and also between two of those layers is the cerebrospinal fluid. And itis is inflammation, so meningitis is inflammation of the meninges, which go not only around the brain but all the way down the spinal cord to protect it. And the most common symptoms are fever, headache, and neck stiffness. So neck stiffness, otherwise known as, or properly known as, nuchal rigidity, occurs in 70% of bacterial meningitis cases in adults. only about half the people affected with bacterial meningitis will suffer from all three of these symptoms. And some other signs associated with meningitis are photophobia, photo meaning light, phobia meaning fear, so fear of light, you know, when it's too painful for people to look at bright lights. And also phonophobia, fear or intolerance to loud noises. In babies, they may not show any of these signs, but the soft spot on top of their head, also known as the fontanelle, might bulge a little bit. And of course, the rash. Everybody knows, I'm sure, that the typical test for a rash, if you suspect someone has meningitis, is to roll the glass over the rash. And if it doesn't disappear, then it very well could be a meningitis. But if it disappears, it's just a normal rash caused by something else. The reason for this disappear, not disappear situation is because most rashes are more superficial, but in the case of meningitis, it's actually called purpura. It's because the blood vessels, the tiny capillaries, have broken underneath the skin, or there's bleeding underneath the skin, so that's why it can't just change color like superficial skin colors, because the blood will still be there. The color cannot go away, so that's the reason. The next symptom you probably won't see very much. It is something called lanugo. It's a very soft, fine, downy hair that grows on the bodies of newborn babies, some newborn babies, and also people suffering from anorexia. So it's the first hair to be produced by fetal hair follicles when the baby is still within the mother's womb. It usually appears around 16 weeks of gestation and is normally shed before birth, although not always. Sometimes it is still present at birth. So as well as this natural occurrence, it can occur in malnourished patients. Not necessarily just people suffering from anorexia or bulimia, but if somebody is in a condition where they are starving and they don't have enough food to eat, and it's not related to a psychological disorder. And the reason this happens is the body is trying to protect itself because it's losing a lot of heat. It doesn't have enough fat, maybe not enough fat to burn, and also not a lot of insulation, maybe because of drastic weight loss. So it's trying to keep as much heat within the body as possible with these tiny little downy hairs. And finally, the last strange symptom that we will look at today is hiccups. Hiccups usually are not a problem. They're usually not a symptom of anything, maybe just having eaten too much or having drank too much as well. But they can mean something serious is going on with your body if they persist for a long amount of time. I think there have been cases in the past where there was, years ago, there was a woman who had hiccups for I think 3 years, and there's been other cases since then of people suffering for a long time with constant hiccups, which must be very, very frustrating. So what can this mean? Well, it can mean a lot of different things. One cause could be damage to or irritation of the vagus or phrenic nerves, because they serve the diaphragm muscle, which is just under your lungs and involved in hiccuping. So this might be caused by a hair or something else in your ear touching your eardrum, a tumor, a cyst, or a goitre in your neck, gastroesophageal reflux, sore throat or laryngitis, or even more serious things such as central nervous system disorders, including encephalitis, which is like swelling of the brain, meningitis, multiple sclerosis, stroke, traumatic brain injury, and tumors. So you're advised to see a doctor if your hiccups are lasting more than 48 hours, or if they are so severe that they are causing problems with eating, drinking, sleeping, or breathing, of course, because we all need to breathe. That's all we'll do today on telltale symptoms, weird symptoms, and the diseases they are related to. So I hope you enjoyed this as much as I did, and we might do more in the future.